Hello students, in this video we are going to see about heme biosynthesis and porphyria. We'll start with a simple question about the vampires. What do you think about vampires? Is it real or a myth? So we are going to start this session with this question and this case scenario. A 22-year-old male comes to OPD with severe blistering and scarring on his face, especially after going outside during the day. Urine looks like port wine color, and whenever he consumes garlic, it triggers severe abdominal pain and confusion. On examination, the patient is profoundly pale. His skin is very pale and his gums are receded. So his teeth was like a fang-like teeth, and the teeth had a reddish brown color when it is examined or exposed to UV light. So this clinical features like the pale skin, scarring on face, blistering and fang-like teeth, receded gums, strange reddish brown color teeth, all these things looks like a vampire. So the patient came to the OPD. Is he a vampire, or we want to know scientifically what disease he is suffering from? So today's class will help us to know that. So we will start with a hint for this exploration of what is the cause for the patient's presentation like a vampire. So it is related to heme synthesis. So what is heme? It is a metalloporphyrin. The metal present is iron. So it is a iron porphyrin complex. And what is porphyrin? This consists of 4 pyrrole rings linked through a methynyl bridges. So we can see the structure of heme clearly in this picture. Here we have 4 pyrrole rings. They are linked by a methynyl bridge. So the number of the pyrrole ring is numbered as Roman number 1, 2, 3, 4 pyrrole rings. And the methynyl bridge is identified as Greek letters alpha, beta, gamma and delta, 4 methynyl bridges. And the side chains of each pyrrole ring is numbered in ordinary numerals 1, 2, 3, 4, 5, 6, 7, 8. And since this is a protoporphyrin, so the protoporphyrin is the porphyrin which is needed for the formation of heme. So it has the side chains or the substituted molecules as methyl, vinyl and propionyl. So there are different types of porphyrin. One is uroporphyrin, which is very much soluble in water, and next is coproporphyrin. This is sparingly soluble in water, and protoporphyrin, it has intermediate solubility. What we saw in the previous picture is protoporphyrin, that is this thing. So it has methyl, vinyl, propionate side chains, whereas coproporphyrin has only methyl and propionate side chain. And the difference between coproporphyrin and protoporphyrin is the addition of vinyl side chain at the second and fourth position. So In case of uroporphyrin, the side chain is only acetate and propionate. And here we can see a number, Roman number 3, uroporphyrin 3, coproporphyrin 3, protoporphyrin 3. So what this 3 denotes? So it is again the type of the porphyrin. So porphyrin 1, if it is numbered as 1, and when the side chains are symmetrical. So for example, if we see here the side chains A, P, A, P, A, P, and when we are coming here, it is not in the same order. It is altered. So this is not symmetrical. So we are numbering it as 3. So when it is symmetrical, we call it as uroporphyrin 1. That means here it will be like this A and P. All the side chains will be same. So in this protoporphyrin, if a ferrous ion is incorporated, that means iron porphyrin complex, the heme will be formed. As we have discussed in the previous slide, the porphyrins can be of two isomeric forms, that is type 3 and type 1. So the type 3 is asymmetrical, that is the form which is commonly present in the human body, whereas type 1 is symmetrical, all the side chains will be in the same order. So, but the type 1 is not metabolized in our body. Coming to the features of porphyrins. So the porphyrins have some special features, like it is a colored compound, but the precursor of porphyrin, that is porphyrinogen, is colorless. So this color, when we measure or when we observe under the colorimetry, or when we pass the light of certain wavelength, the absorbance is more at 400 nanometer. There will be a sharp absorption band at 400 nanometer, and we call this as Soret band. So this is a distinguishing feature of all porphyrins. So for example, if a patient may have porphyria without having porphyrins, that means the patient may have porphyrinogens in his blood. So when we are observing that under light, the porphyrinogens will not form a Soret band since they are colorless, whereas porphyrins will have a Soret band. So that helps us to distinguish this, that the patient has porphyrins. Also, the porphyrins have a special feature that under the UV light they emit a strong red fluorescence. So this property of porphyrins is applied in the cancer phototherapy. The name of this therapy is known as photodynamic therapy. So this is based on the principle that the tumor cells, they often take up more porphyrins than normal tissue. So we can inject the porphyrins in the patient's body, and the tumor cells will take up more porphyrins comparing to the normal tissue, and after that, when we expose the patient to argon laser, it will excite the porphyrins, and that releases free radicals which attacks the cancer cells. So this is known as photodynamic therapy. So the special property of porphyrins are catered for this therapy. So coming on to the heme biosynthesis. So heme is synthesized in almost all the tissues in the body, but mainly in the liver and erythrocyte precursors of bone marrow. So it is not synthesized in the mature erythrocytes as they lack mitochondria. And what are the sites where the heme biosynthesis occur, whether it is cytoplasmic or mitochondrial? it partly occurs in cytoplasma, partly occurs in mitochondria. So this is the picture of biosynthetic pathway of heme. So the initial steps and final few steps are taking place inside the mitochondria. So in between, the other steps are taking place in the cytoplasm. So the mitochondria and cytoplasm, they act as a factory, and lysine and succinyl CoA, they are the raw materials needed for the synthesis of heme, and heme is the final product. And all these blue color are the enzymes which are needed for the synthesis of heme, and we can assume them as like workers of the factory. So if any one of the worker is not working properly, that will lead to breakdown of this process. So if this worker is not working properly, or he is absent for his work, it may lead to accumulation of this product. The first step in the synthesis of heme is formation of delta amino levulinic acid. So the raw material succinyl CoA and glycine are combined by the enzyme ALA synthase. So ALA is nothing but amino levulinic acid. So they take the help of pyridoxal phosphate, and the product formed here is delta amino levulinic acid. So the specialty about this enzyme is ALA synthase is the rate limiting enzyme of this pathway, and it is an inducible enzyme. That means some drugs can alter the activity of this enzyme. Example, barbiturates. So they have the capability to increase the activity of ALA synthase. So why barbiturates increase the activity of ALA synthase? So barbiturates are metabolized in our body by cytochromes. So cytochromes are also dependent on heme. So they are formed by heme. So when more cytochromes are utilized for the metabolism of barbiturates, the cytochromes consume the heme which are formed. So this leads to deficiency of heme, which in turn by feedback mechanism, it induces the ALA synthase to produce more amount of heme. So the ALA synthase has two isoforms, ALA synthase 1 and ALA synthase 2. So ALA synthase 1 is present in all the tissues, particularly in hepatic tissue, and ALA synthase 2 is present in erythroid precursors. So now the first product, delta amino levulinic acid, is formed, and now it is the time for the delta amino levulinic acid to exit the mitochondria to enter the cytoplasm for further reaction. So the delta amino levulinic acid has entered the cytoplasm, and the second step is formation of porphobilinogen. So 2 delta amino levulinic acid in the cytoplasm undergoes a dehydration. So by the enzyme ALA dehydratase. ALA dehydratase helps to dehydration reaction and forms porphobilinogen. So this porphobilinogen is a monopyrrole. Remember that heme needs 4 pyrrole rings. That is, porphyrin has 4 pyrrole rings. So we need a tetrapyrrole ring structure. So till now we have arrived only up to a monopyrrole. And the ALA dehydratase enzyme is activated or positively controlled by zinc, and it is inhibited by lead. So in case of lead toxicity, this enzyme will be inhibited. The next step is formation of hydroxymethylbilane. So So the previous product which is formed is porphobilinogen. It is a monopyrrole. Since we need a tetrapyrrole, 4 porphobilinogen are combined by a deamination reaction. So porphobilinogen deaminase. We can call that enzyme as porphobilinogen deaminase, or by the product we can call it as HMB synthase, hydroxymethylbilane synthase, or porphyrinogen 1 synthase, because this HMB can spontaneously be converted to uroporphyrinogen 1. So this enzyme has 3 names. So what is happening here? Deamination is happening here. 4 ammonia is removed and the product 4 hydroxymethylbilane is formed. So this hydroxymethylbilane is a 4 pyrrole ring product, but it is in a linear fashion. The ring structure is not yet formed. So the next step is formation of uroporphyrinogen 1 and 3. So hydroxymethylbilane, it can undergo a spontaneous cyclization to form uroporphyrinogen 1, and from that coproporphyrinogen 1. As we have discussed earlier, the type 1, which is a symmetrical form, is not metabolized in our body. So usually this is not the fate of hydroxymethylbilane. So in our body, in a normal patient, we have the enzyme uroporphyrinogen 3 synthase to produce uroporphyrinogen 3. This type 3 is what we need in our body. So the spontaneous cyclization route is not the normal fate of hydroxymethylbilane. The normal fate is it undergoes uroporphyrinogen 3 synthesis by the enzyme uroporphyrinogen 3 synthase. The next step is formation of coproporphyrinogen 3. So the uroporphyrinogen 3 is a ring structure. The bonds joining the 4 pyrrole rings are methylene bridges. Methylene bridges. So what we need finally is methynyl bridges. So here we are having methylene bridges, and the uroporphyrinogen has acetate side chains. So it undergoes a decarboxylation reaction by uroporphyrinogen decarboxylase, and 4 carbon dioxide will be released, and the decarboxylated side chains become methyl. So that is what we call it as coproporphyrinogen. So the coproporphyrinogen 3 will be formed. So this coproporphyrinogen moves and enters inside the mitochondria from cytoplasm. The next step, synthesis of protoporphyrinogen 3, takes place inside the mitochondria by the mitochondrial enzyme coproporphyrinogen oxidase. So this coproporphyrinogen 3 undergoes an oxidation reaction where the position number 2 and 4 side chains propionate will undergo an oxidative decarboxylation to become vinyl. So as we seen in the initial slides, the side groups of protoporphyrinogen will be formed. So we will get the product protoporphyrinogen 3. So this protoporphyrinogen 3 has methylene bridges. What we need is methynyl bridges. So it undergoes again oxidation by protoporphyrinogen oxidase enzyme, and this will convert the bridges to methynyl bridges by oxidation. So we will get the final protoporphyrin 3, which is needed for the heme synthesis. And final step is incorporation of iron molecule to the protoporphyrin 3. So for that, the enzyme ferrochelatase, it helps to incorporate the iron into the protoporphyrin 3. So the iron will bind to the nitrogen atom of all the 4 pyrrole rings present in the porphyrin, protoporphyrin. So the final product heme will be formed. Coming to the regulation of heme synthesis, the rate limiting enzyme is ALA synthase, aminolevulinic acid synthase. So it is a mitochondrial allosteric enzyme and it is negatively inhibited, that is feedback inhibition, by its product, that is the final product heme. So more heme is present, it will feedback, it will give the feedback to the ALA synthase to inhibit the pathway, and it is activated by iron. So if the patient has more iron, the iron will activate the heme synthesis. And several drugs, as we have discussed earlier, like barbiturates, so they also have the capability to increase the hepatic ALA synthase. So as we have seen already, the barbiturates will consume more heme by due to the metabolism of barbiturates by cytochrome. So more heme will be utilized for the metabolism of barbiturates. So we need more heme. So the feedback inhibition will activate the ALA synthase to produce more heme. So this picture is about the regulation of heme synthesis. So the product heme will give a feedback inhibition by inhibiting the ALA synthase. And lead toxicity. The lead can inhibit 2 enzymes in this pathway, ALA dehydratase and ferrochelatase. So it can also inhibit the synthesis of heme. And presence of iron will activate this pathway.